Black people and poor people are not receiving adequate health care compared to rich people
Hospitals.
and white people.
Sometimes doctors and nurses, despite their best intentions, hurt patients. A tricky procedure goes wrong and the patient suffers or dies. This happens all the time in hospitals. One estimate says that at least 210,000 people die every year due to preventable harm in hospitals. That's a huge number.
I think we think of hospitals as this place where you go to get better, and that's just what happens. But there's a lot of risk in going to a hospital. There's a lot of things that go wrong, and they don't necessarily have to.
Black people are misdiagnosed constantly. We running around here falling for we want to get free health care when black women die more trying to have babies than any other race in this country.
For more than 30 years, we've seen a disproportionate burden of death among African American women. Today, black women are almost 4 times as likely to die of a pregnancy-related complication compared to white women. And this is really an unconscionable issue. Importantly, emerging data from state-based maternal mortality review committees, and these are groups that come together to try to understand the causes of death, they're showing that 60% of maternal deaths may be preventable. And so we have no reason to believe that this preventability that would vary by race. So we have a lot of room for opportunities for intervention.
What the hell? You want free health care to go die? They're not talking about that. Ask one of them, what are you going to do to help with black women dying trying to have babies? They didn't say nothing like that. They didn't say nothing about adequate health care. They're not saying nothing about being misdiagnosed. More people die in this country of medical malpractice than they do by police killings. 15,000 people die a month in this country.
Okay, thank you for asking that, because this is the 10,000-pound gorilla in the room that nobody's talking about. The third leading cause of death, as published in the Journal of the American Medical Association, is MD-directed treatments. This means you go to a medical doctor, an MD, he gives you a treatment and you die from it. According to the United States Department of Health and Human Services, 15,000 Medicare patients a month are killed by MD treatment.
So you're going to make a healthcare system free